In the sprawling metropolis of Los Angeles, the line dividing worlds is no longer just the curb between a five-star restaurant and a nylon tent. Today, that line is the invisible threshold between a life being lived and a life being lost. A silent chemical predator is stalking the city's most fragile communities, and its arrival marks a terrifying shift. This is no longer an economic downturn. This is a chemical siege. The agent at the center of this siege is fentanyl, a synthetic opioid so potent it dwarfs the power of its predecessors. It is 50 times stronger than heroin. To put that in perspective, the United States Drug Enforcement Administration, or DEA, warns that a dose of just 2 milligrams, the equivalent of a few grains of salt, can be fatal. So, what happens when the most visible homelessness crisis in the United States converges with the deadliest drug epidemic in the nation's history? This documentary is not simply about the loss of housing. It is about how an entire generation is being lost on the sidewalks of a city that once promised dreams. The question echoing through these streets has changed from "where do I sleep?" to "will I survive the night?" The perfect storm. When a housing crisis meets a poison. To comprehend the catastrophe unfolding in Los Angeles, we must first understand the foundation upon which it is built. For decades, LA has been a global beacon of opportunity. But for hundreds of thousands of its residents, that dream has dissolved into a mathematical impossibility. The primary catalyst for homelessness here is not a lack of will, but a lack of affordable housing. The rental market is so brutally expensive that it has ejected not just the unemployed or the marginalized, but also the very people who keep the city running, the students, paying their way through college, the nurses working double shifts, the laborers building the city's high-rises. In 2023, the official count estimated that on any given night, over 75,500 people were homeless in Los Angeles County. This economic precarity is the dry tinder blanketing the city floor. Fentanyl is the spark that has ignited this landscape into a raging inferno. It is crucial to understand that fentanyl did not create the homelessness crisis, but it has transformed homelessness into a potential death sentence. The connection is rooted in a fundamental human response to trauma. A landmark study by the University of California, San Francisco's Benioff Homelessness and Housing Initiative found that the extreme and relentless stress of being unhoused dramatically increases the likelihood of turning to substance use as a coping mechanism. People are attempting to numb the pain, the fear, and the sheer exhaustion of survival. And in this desperate search for relief, fentanyl, due to its availability and potency, has become the most lethal and accessible escape. Before we go further, I want to ask you to pause and think about a time you felt truly lost or overwhelmed. Maybe it was the loss of a job, the end of a relationship, or a moment of profound failure. Where did you turn for solace? A supportive partner? The comfort of your home? Your family? Now try to imagine facing that same despair but stripped of every one of those supports. What would you reach for then? Number 2, the supply chain of despair. How fentanyl conquered the streets. Why fentanyl? What has made this particular substance so dominant? The answer is a grim fusion of chemistry and economics. Fentanyl is a synthetic opioid, meaning it can be manufactured in a lab from chemicals primarily sourced from China. It doesn't require poppy fields like heroin, making its production cheaper, faster, and easier to conceal. This low production cost combined with its extraordinary potency creates a profit margin that is irresistible to transnational criminal organizations. According to the United States Department of Justice, 2 cartels, Sinaloa and Jalisco, are the primary architects of this supply chain. They mass-produce fentanyl in clandestine labs in Mexico and then move it into the United States. Their distribution method is a key part of this tragedy. Fentanyl is often pressed into counterfeit pills made to look exactly like legitimate prescription opioids, such as OxyContin or Percocet, or even common anxiety medications like Xanax. It is also frequently mixed into other street drugs like cocaine, heroin, and methamphetamine. As a result, many users have no idea they are consuming it. A person who has used cocaine for years might suddenly be exposed to a fatal dose of an opioid they have no tolerance for. This supply chain built on deception and driven by profit targets vulnerability. And there is no greater concentration of vulnerability than on the streets of Los Angeles. The encampments filled with individuals disconnected from healthcare and social support networks become the final tragic destination for this poison. They are transformed into captive markets where the supply chain of despair reaps its devastating human toll. Number 3. The new casualties from paycheck to addiction. It is vital that we discard the outdated one-dimensional stereotype of who falls victim to this crisis. The reality on the ground is far more nuanced and far more relatable. To illustrate this, consider a composite of countless real-life accounts from the streets of LA. Let's call her Sarah. 18 months ago, Sarah was a graphic designer for an ad agency. She had a small apartment in the valley, a car she was still paying off, and a circle of friends. She was by all accounts a typical young professional navigating life in a competitive city. Then the economy shifted. Her agency lost a major client and Sarah's position was eliminated. At first, she was optimistic. She had some savings, but the job market was tighter than she expected. Weeks of searching turned into months. Her savings dwindled, eaten away by a rent that demanded nearly $2,000 a month. What choices would you make in her position? Do you give up your apartment to save your car, which you need for job interviews? Or do you sell your car and risk being unable to get to a potential job? Sarah chose to keep the car. She moved her most precious belongings into a storage unit and started sleeping in the back seat of her Honda. The shock was profound. The shame was a physical weight preventing her from calling her parents and admitting what had happened. She felt she had failed. Life in her car was a state of constant anxiety of hiding in plain sight. The isolation was the worst part. She was surrounded by millions of people, yet completely alone. It was during this period of intense despair that someone offered her a pill. They didn't call it fentanyl. They told her it would help her sleep, that it would quiet the panic in her mind. It was offered not as a party drug, but as a medication for her pain. And that pill, that small, deceptive dose of relief, was a trap. Sarah's story is not an outlier. It is a cautionary tale of how in modern America anyone can be just one layoff, one medical bill, one personal crisis away from the street. And once there, fentanyl is waiting. Number 4. Ground Zero. Haqwain. Public spaces turned into open-air ICUs. The collision of these forces, economic desperation, and a poison drug supply has fundamentally altered the landscape of Los Angeles. The city's public spaces have undergone a horrifying metamorphosis. Parks, library courtyards, bus stop benches, and freeway underpasses are no longer just shared civic areas. They have become the grim frontlines of a public health emergency. They are, for all intents and purposes, open-air intensive care units. First responders and volunteer outreach teams now navigate these spaces not just as social workers, but as combat medics in a chemical war. Their primary tool is no longer just a bottle of water or a sandwich, but a dose of naloxone, the opioid reversal medication. They are in a constant race against the clock, responding to calls for people who are unconscious, their breathing shallow, their lips turning blue. The sheer concentration of overdoses has given rise to a terrifying phenomenon known as overdose clusters. This is when a single particularly potent batch of fentanyl-laced drugs hits an area, causing multiple people to overdose at nearly the same time. One outreach team can find themselves rushing from one tent to another, administering naloxone and performing CPR, trying to prevent a mass casualty event. The data from the Los Angeles County Department of Public Health confirms this brutal reality. Fatal overdoses among the unhoused have skyrocketed, and fentanyl is the primary culprit, a key factor in a majority of these preventable deaths. The city's sidewalks have become the stage for a daily struggle between life and death, a battle fought by heroes with naloxone kits against an invisible chemical enemy. Number 5. System overload. A city's services on life support. The ripple effect of this crisis extends far beyond the encampments. It's putting the entire city's emergency infrastructure on life support. Think about the 911 operators, the paramedics, the firefighters, and the emergency room doctors and nurses. They are trapped in a brutal, unending cycle. They receive a call race to the scene, administer life-saving naloxone, transport the individual to an already overcrowded ER only for that same person to be discharged hours later with nowhere to go but back to the very streets that nearly killed them. Days, sometimes hours later, the cycle repeats. This isn't a sustainable model, it's a system in a constant state of cardiac arrest. The American Medical Association has been vocal about this, stating that the opioid crisis has placed an unprecedented and crushing burden on the nation's emergency care system. Hospitals are designed for acute medical intervention, not for solving the complex intertwined problems of homelessness and severe substance use disorder. And what about the shelter system? These shelters were largely designed to provide a temporary roof for individuals experiencing economic hardship. They were not built to be detox facilities or mental health clinics. The staff, however dedicated, are often not equipped to manage the complex medical needs of someone in the throes of fentanyl addiction and withdrawal. They lack the resources, the training, and the medical personnel. As a result, the very places meant to be a refuge have become another overwhelmed and under-resourced node in a failing system, unable to cope with the sheer scale and severity of the fentanyl crisis. Number 6. The unofficial first responders, harm reduction in the trenches. But in the midst of this systemic failure, a different kind of response has emerged from the ground up. They are the unofficial first responders. They are community outreach teams, volunteers, and activists, everyday people who pack their backpacks with naloxone, which is often known by its brand name Narcan, and walk the streets going tent to tent. They operate on a philosophy known as harm reduction. It's a pragmatic and compassionate public health strategy recognized and supported by leading health organizations like the CDC. The core principle is simple: save the life first. Keep people alive today so they have a chance at recovery tomorrow. It means meeting people where they are without judgment and providing them with the tools and knowledge to stay safe. This includes distributing naloxone, providing clean syringes to prevent the spread of diseases like HIV and hepatitis, and offering fentanyl test strips so people can check if their drugs are contaminated. These volunteers are not waiting for a perfect solution or a government consensus. They are in the trenches building relationships, establishing trust, and reversing overdoses that would otherwise be fatal. The Centers for Disease Control and Prevention has stated that programs providing naloxone to community members are proven to significantly reduce overdose deaths. These are the quiet heroes of this crisis, performing life-saving work that the official systems are not yet structured to do, proving that compassion, when activated, is a powerful force. Before we move on, I'd like you to consider something. If you saw someone collapse on the street, your first instinct would likely be to call for help to do something. What if the solution was in your hands? If carrying a simple nasal spray like Narcan could give you the power to save a life, would you do it? It's a question that gets to the heart of our shared responsibility in a public health emergency. Number 7. The policy paralysis, the battle for LA's soul. So, if we have life-saving tools like naloxone and dedicated people on the ground, why is this crisis getting worse? The answer lies in a deep and paralyzing political division. In City Hall and in community meetings across Los Angeles, a battle is being waged for the soul of the city's response. This isn't a simple debate. It's a fundamental disagreement about the nature of the problem itself. On one side, you have the law enforcement approach. This perspective views the crisis primarily through the lens of crime. Proponents argue for tougher policing, more arrests for drug dealing, and use and dismantling encampments to restore public order. The focus is on punishment and deterrence as the primary tools for change. On the other side, you have the public health approach. This perspective sees the crisis as a disease. Its advocates argue that you cannot arrest your way out of an addiction epidemic. They call for a massive expansion of treatment services, supportive housing, and harm reduction strategies. The focus is on healing and support, treating addiction as the medical condition that it is. This clash leads to policy gridlock. Debates rage over models like housing first, a strategy that prioritizes getting unhoused individuals into permanent housing immediately without preconditions, like sobriety, and then providing wraparound support services. While proven effective in many cases, it faces political opposition. Other controversial proposals like mandatory addiction treatment raise complex legal and ethical questions. While the politicians and policymakers debate caught between these two opposing views, a consensus remains elusive. And this paralysis is not without consequence. Every day of inaction is measured in the rising number of lives lost on the streets. Number 8. The Olympic Shadow, a race against death. Not deadlines. Looming over this entire crisis is a massive, glittering deadline, the 2028 Olympic Games. As Los Angeles prepares to welcome the world, there is an immense and growing pressure to clean up the city's image, which for many means making the homelessness crisis invisible. This pressure manifests in sweeps of encampments, where people's tense belongings and entire lives are dismantled and thrown away, forcing them to move to another block, another neighborhood to start over with nothing. But activists and public health experts are sounding a dire alarm. This approach is not a solution, it's a potential catalyst for a death wave. The National Coalition for the Homeless has warned for years that these kinds of sweeps, often conducted before major public events, serve only to criminalize homelessness and make the problem worse in the long run. When you forcibly disperse an encampment, you don't just clear a sidewalk. You sever critical lifelines. You break the fragile networks of trust built by outreach workers. You make it impossible for them to find the people who rely on them for naloxone, for wound care, for a connection to services. Pushing people into isolation is a death sentence during an overdose epidemic. So Los Angeles faces a profound choice, a question that will define its legacy long after the Olympic flame is extinguished. Will the city choose to prioritize a sanitized, temporary image for the television cameras, or will it choose to save the lives of its own citizens? It's a race against time, but the finish line shouldn't be the opening ceremony, it should be the end of preventable deaths on our streets. The crisis on the streets of Los Angeles has evolved beyond a story of economics. It has become a crisis of biochemistry and of compassion. Fentanyl does not discriminate, and its terrifying spread has exposed the fatal weaknesses in our social safety net. It has shown how quickly a life can unravel and how thin the line is between stability and survival. The solution will not be found by looking away, by building higher walls, or by simply wishing the problem would disappear. It will be found by looking directly at the truth of the situation. This is a mass poisoning. This is a public health catastrophe, and it demands a healthcare response. It demands empathy over judgment, treatment over punishment, and housing over hostility. The future of Los Angeles and of countless cities across America facing the same scourge will not be defined by the skyscrapers it builds, but by the lives it chooses to save. This is not someone else's problem. In a society, there is no someone else. This is a fight for the soul of a city. This is our fight. Thank you for joining us on Bear City 24. If you believe these stories need to be told, please subscribe to our channel and share this documentary. It helps us continue our work. Join us next time as we explore another story from the heart of the urban world.